It is almost impossible to outline the benefits of being a member of the National Association of Community Health Centers. I have been working with Unity Healthcare for 22 years, and since the day I began working, our board of directors decided that we should join our national association. The benefits are immense, and many of them are immeasurable. Like, for instance, the annual appropriations in and of itself is a great policy benefit. But if you look at other programs such as the Federal Tort Claims Act, which enables health centers to actually have medical insurance for our doctors and for the organization, it's almost impossible to measure what it would be like financially if health centers had to incur that expense. And that was achieved by the forward thinking and the wisdom and the policy initiative of our National Association, NACHC. Unity Healthcare has benefited in many ways from being a member of NACHC, beyond the broader concepts of policy initiatives. Specifically, Unity in the last 2 years has received $12.5 million for reconstruction and construction of new health centers. Well, there is no doubt that the National Association was absolutely key to us achieving that specific grant, and indeed several health centers throughout the United States. In a more smaller way, for instance, recently, through a linkage with the National Association, Unity was able to get a $50,000 grant from Covidian, and the result of that grant was we were able to open a walk-in clinic with other funding to achieve broader access for our patients. I value so much. I value the opportunity for networking with colleagues, coming to a National Association meeting. There's lots of excellent lectures and talks, presentations. It provides me with update on policy, but most especially it brings us together around a common purpose at a very critical time in the life of community health centers, with healthcare reform implementation, with the need not only to be careful about what's happening out there in the larger healthcare market, but also to develop our business skills and to develop our systems to make sure that the opportunities provided to us in healthcare reform are fully availed of by our membership and specifically by Unity. And we have been learning on a pretty much a daily basis through the communications that come out from NACHC how to implement patient-centered medical home. Things like that which are going to be key to our long-term success. I have benefited from being able to talk to colleagues throughout the United States who are fellow NACHC members. That just kind of gives me a sense of comfort. We are working right now have worked on a strategic plan. We're working on succession planning within the organization, leadership development, to be able to talk to folks in California, Mississippi, Michigan. All of these things are brought about by NACHC. It is kind of state-of-the-art, and I do not know any organization that provides the kind of services for its members that National Association does for us. The annual conference, the Community Health Institute, is critical. It's a time when policy and aspects of healthcare reform are being discussed. That is probably one of the exhibitions that we have here, exposing us to new equipment and to new ways of implementing meaningful use within our health centers. This is very valuable. But on the other hand, the Policy Issues Forum, which is held every spring in Washington, D.C., is a critical time. It's no more critical than it will be this coming Policy and Issues Forum in March, because we are going to be dealing with the results of an election regardless, and we need to be prepared to address the policy implications of that election. In a very critical time with healthcare reform, as we're looking towards recruiting a workforce that will address the needs of millions of people coming into healthcare, I think NACHC is a key entity in helping us, number one, to develop training for our existing staff and help in recruiting other primary care doctors and primary care providers into the system Otherwise, we'll be overwhelmed with the demand and not having the resources to address them. And I look to NACHC, and I'm grateful to have NACHC to help us, to lead us in that initiative.